Hello everyone. After the NGN training we had today, I did decide to go ahead and create an NGN Excel chart as I will be implementing this in my summer courses. And so I just wanted to go ahead and get it done while it was on my brain and it was really fresh. So I wanted to share with you what I did. I will include this Excel chart in the email. So you'll be able to use it. You could copy it into your own questions, and I'm going to show you how I did that. But I'm going to start with the Excel chart first. I will give you a few disclaimers throughout about things that Excel allows us to do that currently ExamSoft does not. But I have reached out to our ExamSoft rep asking for increased functionality of their Excel spreadsheet that is built into the program because it does not allow for complete realism. And I've explained that to the ExamSoft rep. So I hope that there are some improvements. If I hear back, I will most certainly share that with faculty. So as you can see, I have built a chart very similar to what you would see in Meditech or Epic. So every sheet, or I may accidentally slip up and say slide because I'm used to PowerPoint, has this basic information. So when you get into actual ExamSoft is where I would insert the specific data. I would not do that on here unless you're going to copy it from Excel to ExamSoft. I'll show you both ways to do it, but let's say you wanted to type in, you could type in Joe Dirt. He's 66, his provider, his allergies, no known drug allergies. Code status full, admit weight, let's say 120 kilograms, BMI 40.1. Nurse's note, same way. I do want to give you this disclaimer that it will automatically, because I merged cells, put your font at the bottom. So if you would like to move it to the center or top or left justified, you would just use the lines, and that's going to be the same as in ExamSoft. So your flow sheets, this gives you an idea of things that you could do. You could have unlimited flow sheets. You could do repositioning, anything that you do in the hospital, you could do here. I do want to show you that I have been making these thick borders for the students realize that it is a different cell of data. So let's say you wanted to add more dates and times of data, you would be able to copy this down and add another one. Okay, so you could have 3 dates and times. Provider, I have a place for provider notes where you could type in your own physician notes. Orders the same way. Labs and diagnostics, I've given you kind of a starting place, but let's say you wanted more. You wanted a whole CBC, you wanted CRP, you wanted some blood gases. You'd be able to copy this down. MAR, I have created this off of pretty much Epic as my guide. You can see a complete example there and then a blank example for you to fill in yourself here. And again, you can copy it one cell at a time, or you can just drag and drop the entire portion of that MAR chart. This is another functionality that currently is not permitted. I did mention that these are not allowed currently in ExamSoft, but neither is inserting an image into their spreadsheet. I did also ask for that to be changed due to realism. I was thinking that you could do, if you were a high acuity nurse, you'd be able to put rhythm strips in there. We could put wounds. We could put patient IV sites as pictures. Let's say something went wrong and they have to identify that that's a problem or what is it that they're seeing. So it'd be able to be more all-inclusive, but currently, again, patient images are not permitted. So this is what it looks like. Again, you have all of this in the email. I will share this with you. And I'm now going to go to ExamSoft. I am building in the sandbox, and where I'm at in the sandbox is actually in just a NGN chart. I also have it on the mock exam, but I wanted to show you on NGN chart how I did this, and I've already created one just where I can reference and for I could practice building before I did this. So we're going to go to click add, and we're going to do a multiple choice question. We're going to make it where the question tells the student the directions, just like what we do on drag and drop. But I'm going to say using open spreadsheet. I'm going to show you why I say that in just a second. Or you can say using the chart found in open spreadsheet. Identify the patient data that concerns you the most. I'm going to make this very simplified. Kelly gave us wonderful examples. I will be utilizing several of them in the future of how to word questions and how to ask different things. But for now, I just want to give a simple one. So I'm going to do potassium, blood pressure, emission note, emission nursing note. And let's say patient image on 8/29 XXX. I'm just making things up, guys. So we're going to click that as the key. So you're going to click here and do spreadsheet. And you're going to open the spreadsheet. Now currently this spreadsheet is blank because this would be you building a spreadsheet off of what I'm sending out in the Excel. You cannot insert the Excel file into this Excel. So what we're going to have to do is we're going to have to pull this one up and we're going to have to copy this down. Now, the other thing you can do, and this might be the simpler thing to do, is to duplicate the entire question into your exam. So you would create an exam with the question I've already created off of this. But I'm going to show you what it's like to build your own because sometimes we need to edit to our course and make it fit what we're doing. So we're going to copy this and we're going to paste it. Okay. Now, the one thing I will tell you is not all the formatting always copies correctly, so we need to make that a little bigger. That works perfect. Spreadsheet 2, we're going to go back, go over here, and we're going to do the same thing, just this one's bigger. So we're going to go all the way down, copy it, go back to this page, go to sheet 2, and insert. Again, this is the formatting is a little different, so you might need to make that a little smaller. But there is the same thing that was on our Excel sheet is now here. You're going to keep going all the way till you get to the end of all the sheets that you want to include for the student. So I'm going to end after this one just because sake of time. So we're going to, it did not copy that one. And sometimes this, I'm not going to lie to you, it does that. It doesn't like that I have selected data. And you have to play with it. So we're going to go over here and we're going to paste it. It's still not doing it. It did this to me earlier. It worked for several and I had to eventually get off of all the selected because it was trying to copy more than one selected. So let's check to make sure, yep, like that one had something selected. So I'm going to use this one, copy everything, and then go over here and try to insert. Why is it doing that to me? These are the things that I haven't exactly figured out why it does it one way and not another. But we have seen it works, and just all of a sudden, it is not liking what I'm doing. I do not know. Let's just clear the contents and try again. If nothing else, we're going to keep going because we know that it works. I just don't know why it's not working. Let's just do this portion. Maybe it doesn't like all this different. Huh. I don't know. Let's try getting rid of this. and adding. I was also going to show you that. You just right click it and add another sheet. And you can rearrange them. You can drag and drop them with your right click. So let's try doing sheet 4. Let's try this again. And these are the things that we will just run into. And I have done this several times before I recorded this video, and it did it once and then never did it again. So as you can tell, I played with that on pause for just a few minutes, and I finally figured out what works. If it is doing that to you repeatedly, just push close and get back into the spreadsheet. And I do want to put another disclaimer out there. Don't be like me and search for the save button on the spreadsheet over and over and over, because there is not a save button. When you click close, it automatically does it. You'll just reopen it and we can insert another sheet. So if it does what it was doing to me just a minute ago, just get out of it and try it again. So now I want my labs and diagnostics. So you just be able to copy all of this down, copy it, and insert. And see, it's doing it again. So what we're going to do is we're going to close it, open it, and then as soon as I do this, it worked the last time. So it copied. So you can see what I've been doing. You would just work on it. And then once you have your sheets, you'd be able to go in and edit the content to match your patient scenario. You could, again, keep adding by clicking right click and inserting a sheet until you have all the data you need. So we're going to push close and we're going to push save. Saving it is ultimately what allows the spreadsheet to save the way you have created it. Don't forget to push save before you come back to this main ExamSoft page, or you will lose everything you did. Made that mistake as well. So let's say that you wanted to see how it looks for the student. This will be what it looks like for the student. So again, we want to give them some kind of key or some kind of keyword to tell them to click open spreadsheet. I believe that this probably, if we're going to start utilizing it frequently, does need to be on the course mock exam, for they're used to going and clicking through the spreadsheet to answer the question. I am a big fan of this spreadsheet to create that realism that we are not going to screenshot the two little portions of the Excel spreadsheet that has the answer on it. I want them to be able to read through the chart and pick out that information and discriminate the important from the non-important information. So that is why I like using this open spreadsheet more than screenshotting parts of the chart and putting it within the question body. So now what you would be able to do is you'd be able to duplicate this as an unlinked assessment into your course. And that way you have these questions that I've already kind of started for you in your course, or you now know how to build from the Excel document I am sending you to directly put this content into your course as well. Once you have one part of your question, so let's say you're doing 6 questions over your case study, you'd be able to duplicate that question and it keeps your spreadsheet. So all you'd have to do is change the base of the question and add a few more things to your Excel sheet. You don't have to start over on building your Excel sheet. I am sorry that this was a little bit diluted with some errors with copying and pasting from my Excel to ExamSoft. It does happen. Just close it out and get back in. But I do hope that this template helps and that showing you how to insert this spreadsheet is a helpful tool for you. If you have any questions, please don't hesitate to reach out to me.